All right. Good afternoon, everybody. On behalf of the organizing committee of the Immunowebinars, that is a joint effort by the Biophysics Institute at the Federal University of Rio de Janeiro and the Biological Science Institute at the Universidade de São Paulo. I welcome you all and welcome Dr. Hugo Caire Castro Parianeto for this presentation today. Dr. Hugo is graduated in medicine from the State University of Rio de Janeiro in 1988 and got his PhD in cellular and molecular biology from the Oswaldo Cruz Foundation in 1992. He was a postdoctoral fellow in the molecular biology and human genetics program at the University of Utah from 94 to 96. And he's currently a senior researcher at the Instituto Oswaldo Cruz Laboratory of Immunopharmacology and was vice director of research, technological development, and innovation from 2013 to 2017, both at the Instituto Oswaldo Cruz. He has large experience in the field of immunology and pharmacology with emphasis on inflammation. Among the more than 200 papers published, one can find many seminal contributions to the identification of potential targets and treatment for sepsis. And today we are very lucky to hear some of his work on the neuroinflammation and cognitive sequelae in offspring after gestational sepsis. So, Dr. Hugo, thank you very much for being with us today, and you have the floor. Thank you.
Well, thank you very much, Dr. Bruno. It's a great pleasure and an honor to be here today and have the opportunity to talk to you a little bit about our work regarding neuroinflammation and the cognitive consequences for the offspring after gestational sepsis. So I will start by giving you some backgrounds regarding sepsis. And the definition of sepsis has been evolving over the decades. And we first had a consensus meeting in the early 90s with the first definition of sepsis. And then this definition changed over the decades. And the last consensus meeting about sepsis definition, it was in 2016. And basically the definition accepted today is that sepsis is an organ dysfunction that is caused by the host's dysregulated response to an infectious agent that threatens the maintenance of life. So this is the definition that we work with today for sepsis. Sepsis is a very important cause of mortality worldwide, and actually is the first cause of mortality in the ICU anywhere in the world. It is still a very it has still a very high mortality rate. It's around 25% in developed countries. In Brazil, it ranks about 45 to 60%, depending on where you look. And so it's still a very important cause of mortality in critically ill patients. And the World Health Organization has declared that sepsis is a public health concern in the whole world, and created that the September 13th as the Global Sepsis World Day Sepsis, so that make people more aware about the importance of this condition everywhere in the world. Sepsis is usually a condition of the old age or the very young age. That's the most susceptible populations if we look at the incidence of sepsis. But also other groups of patients have increased susceptibility, and it's a major problem in pregnant women as well. So the mortality for maternal mortality for sepsis is very high, is one of the most important causes of mortality in the pregnant women. So this is very important for our goal here today. But not only mortality is very high and very important issue in sepsis, but we learned through the years that actually patients who survived an episode of sepsis, they frequently develop impairments in their post-sepsis life. Those could be motor, muscular impairments, but also neurocognitive and psychiatric alterations as well. This slide is just to show you in a case of neonatal sepsis, the sepsis happening to the very young children, that despite the high rate of mortality, we will also have a significant amount of patients that develop significant impairments after sepsis. And as I told you, those impairments could be neurological, muscular, psychiatric, or any other kind of sequela after sepsis. So this is, of course, of great concern and importance, and not a lot is known about this so far. So if we look now at the development of the central nervous system, we can see that the central nervous system started to develop very early in just during the gestational period, but this development is not over after birth, and actually continues through even the adulthood, the life as an adult, specifically with synaptic pruning and myelinization process that happens later on after birth. So this is a continuing process that starts very early during the gestation. And of course, if we think that a challenge or a kind of an aggression to the system is made at different points of this development, we could have long-term consequences that would vary depending on how severe was the challenge, the aggression, or when it happened during this process of development of the central nervous system. So this is important to keep in mind. And if we look, for instance, at the developmental timing of psychiatric disorders, we see that most of those disorders show up, they are diagnosed very early in the life, usually in the as infants. For instance, for autism, attention deficit, anxiety, or a little bit later on for schizophrenia and depression. But this is also important to correlate this with what is going on regarding the development of the central nervous system. So there is probably a good correlation between what's going on in the central nervous system as a developmental stage, and also the manifestation or the clinical signs of the disease that is happening there. So if we look at the sepsis scenario, it's been shown actually that neonatal sepsis is associated with some neurological dysfunction or changes in the neural development in these children later in life, indicating, this is in the clinical scenario, indicating that the acute disease, the acute infection of sepsis in very early in life, and during the neonatal period, would impact on later stages of life of those children. So this is, of course, interesting, and we actually don't know much about what is going on there, what causes that kind of things, and how to interfere with that. So if we go back a little further regarding the developmental stage of the central nervous system, and we have an infection or a sepsis happening during pregnancy, we could hypothesize at least 3 different outcomes from this situation. One is that the mother has an infection. It's not complicated, it's an uncomplicated infection, not severe, and that doesn't really make any difference on the development of the offspring, and we have a normal development. In the very worst scenario, if we have a very severe infection, the pregnancy could be terminated early, sometimes with stillbirth, and then that's, of course, very, very dramatic. But there is something in the middle of that, when you have infection that is severe enough to affect the development of the fetus in many different ways, and as a consequence, you can have a neonatal that is severely ill and may die not long after being born, or a neonatal that can have impairments that will survive through that, but have impairments later in life. So based on this proposition, that's when we kind of got interested in trying to figure out what is going on there and what are the consequences. Actually, we've been studying the consequence, long-term consequence, specifically neurological or neuropsychiatric consequence of sepsis for quite some time, for the past, I don't know, 15 years maybe. And it's been known and very well established that sepsis that occurs in the old patients, in adults, old population, is associated with an increase in or a decrease in cognitive performance, a decrease in memory formation and learning abilities, some things like that. This is being very well documented in a clinical scenario, and there are a number of reports, papers showing that patients who survived sepsis, they develop memory impairments, learning disabilities, and so on and so forth. So this is very well recognized in now in the clinical scenarios, and we started a long time ago to study this in the laboratory in using septic or sepsis models in mice. For instance, the induction of sepsis by cecal ligation and puncture, the CLP model. Basically, is a peritonitis that we induce in the mice. Mice develop sepsis, and we use those animals to study the situation. And we looked specifically at the dysfunction of the central nervous system in these animals, which is called in the field as sepsis-associated encephalopathy. So we were interested in understanding what was going on during this acute challenge to the central nervous system caused by sepsis, and what would be the consequence to the animals after this situation. And we showed, and I'm just going to show you some old data about that, so just to make a context about what I'm going to show you in a minute. But basically, we show that the animals that develop sepsis, they have a clear alterations in central nervous systems. For instance, they have a decreased number of perfused capillary in the brains, and we can see that here by intravital microscopy, that the animals that were subjected to sepsis, the CLP animals, they have decreased capillary density in the brains of those animals. This is translated into a decreased blood flow. As you can see here, using a laser speckle measurement, the red area is the measurement of blood flow, and animals that were subjected to sepsis, they had decreased in the blood flow in the brain. So this is a cranial window of the animal showing the microcirculation, blood flow in the brain. So they have this. They also have a breakdown of the blood-brain barrier. So dysfunction of the blood-brain barrier with extravasation of proteins and liquid, causing edema in the brain. And this is shown here by MRI of the mice in the left part of the slide. So the white area here denotes an increase in edema formation, which is seen 24 hours after induction of sepsis in mice. And this is also detected in human beings. As you can see on the right side of the slide, you can detect the presence again of edema by MRI. So this is has a correlation with the clinical scenario, and showing that the microcirculation in the brain of septic animals are altered by sepsis. Not only this, but also we saw that this is accompanied by activation of microglial cells in the brain of those animals. They acquire a amoeboid shape, which is an indication of an activation state of those cells in septic animals. And we also showed that those animals that were subjected to sepsis and they survived the acute phase, the infection, they develop later on, after 30 days or 60 days, a memory and learning disabilities. And this is a test using the Morris water maze, showing that the animals with sepsis, the black column, they have a performance that is indicating that they have a disability in memory and also in learning capacity of those animals. So this is, as I told you, we used this as a way to understand what was going on in the clinical situation, and we did a lot of work on this in the past. This is, again, another test just to show you using a different model of sepsis. In here, we used a pneumonia model, inducing pneumonia with Pseudomonas aeruginosa, and then looking for cognitive impairment later after 30 days on the surviving animals. And this is, in this test, we use the fear conditioning test, which basically access the aversive memory of those animals, and we could again see that those animals have memory problems after sepsis. This effect seems to be, as I mentioned before, related to the severity of the acute damage, the acute reaction that the animal had. So basically, we develop a clinical score to try to grade the severity of the disease that the animals presented. This clinical score was actually composed by many different observations that we could do with the animals, like the way the fur is looking, the way they behave, diarrhea, lacrimation, and other signs of disease that we give points to to the presence of each one of these alterations, and then we have a score, the highest score, meaning the animals were very ill, severely ill. The lower score, the animals were not that ill. So based on that, we could follow individual animals and correlate the intensity of the initial disease, the acute disease, with the cognitive outcome later on the surviving animals. And we could show that actually those animals that were sicker had a more severe response during the sepsis induction. They were the one with worse performance on the cognitive tests later on. So this was one of the things that we showed, and we also showed that again, not only the intensity of the response is important, but also the development stage of the animals in life. For instance, aged animals were much more susceptible to this aggression, to sepsis, than young animals. So what we did was we used a model where we took young adult animals, so they were 30 days old, 35 days old, and aged animals that were like a year and a half old or older than that. And we subjected those animals to daily injections of LPS for 4 weeks, and the dose of LPS used was a very small dose, a subclinical dose. It didn't induce any change that we could see by looking at the animals, so clinical alterations, and not many other alterations if we looked into the blood of those animals. So it's a very low dose of LPS. So we did that, and after this period of continuous stimulating the animals, we compared the group of young mice with the group of aged mice, and we showed that aged mice, they had a pro-inflammatory condition in the brain of those animals, a profile of pro-inflammatory profile in the brain of those animals, with activated microglia that we could see here in the picture, or also by Shaw analysis, showing that they have a different kind of response compared to young mice that were subject to the same stimulation. So we asked if this would impact on the cognitive outcome, and again we showed that the aged mice, they develop a cognitive damage, decrease in memory ability, as compared to the young mice subject to the same process of LPS, low dose of LPS injection. So showing that age is another factor that is important for this outcome. Okay, so this actually led us to raise the question that if sepsis is a disease that we see mostly on aged patients and young patients, so neonatal period and the old age period, what would happen if we have sepsis very early in the developmental process of the central nervous system, regarding the neurocognitive, neuropsychiatric outcome later on those animals. So our question was basically the following: could sepsis during the gestational period impact on the cognitive and neuropsychiatric development of the offspring? That's what we set off to investigate more recently in this project. So we know that one of the main sites for infection and sepsis during the gestational period or neonatal period, as well as for old population, is the lung. So it's pneumosepsis. So we decided to use this model of pneumosepsis as our model to study this condition. And we developed the following strategy to answer the question. We had mice that were pregnant, and we divided those pregnant mice in two groups. On the 14th day of pregnancy, that is E14, those animals were injected intratracheally with saline, and that would be the control group, or a concentration of Klebsiella pneumonia, a bacteria. So, and that was to induce pneumonia in the pregnant mice. After that, we would follow those animals with the clinical score that we developed before, and I showed you this a few minutes ago. And we identified the beginning of the clinical disease by using this clinical score. So after 5 hours of sepsis induction, we started treating those animals with antibiotics. And the reason for that is that we would like to look at the offspring of those animals. So we would try to rescue the pregnant mother from sepsis so that we could work with the offspring later. And then this treatment is very successful. We use an antibiotic, meropenem, to treat those pregnant mice for 3 days, basically. And this was very successful. The majority of the animals would survive and come to term, and after 5 days, we would have the birth of the animals. And then we were able to look at those offsprings at different time points, at postnatal day 2, postnatal day 8, 30, or 60. And then we could look at their conditions, cognitive tests, and do basically whatever we wanted to try to see what was the consequence of sepsis induced on the 14th day of gestational period in this model. So that's what we did. And basically, that's the results that we got with this model. If we look at the clinical score of those pregnant mice, you can see that it's already positive for sepsis very early, around 4 hours after the induction of sepsis. They already display clinical signs of disease. So that's why we started treating them 5 hours later after the induction with antibiotics. This clinical score goes up until 24 hours after the induction, and then it tends to go down until basically come back to baseline after 3 or 4 days after treatment, basically near the birth of the animals. If we look at the same day, if we look at the placenta of those pregnant mice, we could detect a increasing TNF alpha, IL-1 beta, IL-6, and that is showing to us that we have an inflammatory reaction that is going on, that is affecting the placenta as well on those animals, as expected, because we have a systemic inflammatory syndrome in the sepsis model. So if we go on and look at the animals after birth at P2 and P8, postnatal day 2 and postnatal day 8, we can clearly see that the sepsis induced in the mother has a major impact in the offspring. And just by looking at the animals, you can see a delay in the development. The weight of the animals is completely different. The animals that came from septic mothers, they have lower weight and delayed development in that stage of life. So showing that we had, of course, a clear impact on the development of those animals right after birth. If we look at those same animals for inflammatory response, we could see that those animals, they actually have an inflammatory response by themselves at day 2 after birth, mainly. If we look at the liver, the lungs, and also the brain, we can see the increase in cytokines such as TNF-alpha, IL-1 beta, IL-6, showing that those animals have a systemic inflammatory response that is also getting into the brain of those animals. At day 8 after birth, we still see some alterations, but there's a clear trend to the resolution of this inflammatory response, and we don't see much in the liver, but we still see TNF-alpha increased in the brains, for instance, a little bit of IL-6. So we still have some inflammation going on there, but it's clearly on going on the direction of the resolution of the situation. So we also looked at the same time points at the blood-brain barrier of those animals. And what we saw was that P2, we used here a Evans blue dye technique. We basically measured the amount of Evans blue that was extravasated into the brain of those animals. And we can see that P2, we have a very clear extravasation of Evans blue dyes, showing that we had a disruption of the blood-brain barrier in these animals. At P8, this was not that clear. Again, going with what we saw with the cytokines, it seems that the process is going to a resolution, is coming down a little bit. So, but we definitely did that. And we also looked at signs of lesion and other signs of lesion and inflammation in the brain tissue. And here we looked specifically at the cortex, and we show that during the day 2 after birth, the P2, we have an increase in lactate, in LDH activity, in nitric oxide production, and the production of a chemokine KC in this area of the brain. So suggesting that actually we have really inflammation and probably tissue damage going on during this time period. So we also decided to see if this would somehow impact on the synaptic integrity of those animals. And what we did was we used 2 markers for synaptic density, presynaptic markers, protein synaptophysin, and a post-synaptic marker, a protein called PSD95, as markers for synaptic integrity on those animals. And this is the result for P2, so 2 days after birth, and we see that different areas of the brain, the hippocampus, the neocortex, frontal cortex, and cerebellum, they all have change in the expression of synaptophysin and PSD95 with a decrease in the expression of those proteins in these animals. This is correlating with the data that I showed you before, and now specific for these brain areas, about the cytokines. So the cytokines of the hippocampus, neocortex, frontal cortex, cerebellum, they are increased, as I showed you before, for the whole brain. So showing that those animals have an inflammatory reaction, and it seems that they also have a impact on synapses integrity during this time. If we look at day 8 after birth, so postnatal day 8, we can see basically the same trend, trend that we saw before, that I showed you before. There is still some changes there in the expression of synaptic proteins. Some cytokines are still increased in those areas, in the hypo and the neocortex, in the frontal cortex, for instance. But there is a trend towards resolution or a decrease in the intensity of the alterations in P8 in these animals. So, okay, but this is still okay, and we saw how affected those animals were after sepsis at P2 and P8. But when we look down the road on P30, that is 30 days after birth or 6 days after birth, those animals, they didn't show any clear clinical changes or clinical difference comparing the animals that were born for septic mothers from the ones that were born for the control mothers. So they look normal after 30 days. So we did again the same kind of question, and we looked at the synaptic proteins at P30 and P60 of those animals, and also on the cytokine profile in this, at this time point. And what we saw, for our surprise, is that we could still see differences in the expression of synaptic proteins, specifically PSD95 was still altered, decreased in animals at P30, and some cytokines and major, specifically TNF alpha, was still increased in some areas of the brain, the neocortex, for instance, was still increased, although the other cytokines were basically decreased or based to basal levels at this time point. But we still saw a kind of a cytokine scar response in these animals at P30, and also this change in synaptic proteins expression. This is the same thing for P60. So the synaptic protein expression is still altered at P60. TNF is still increased in the neocortex at P60. So basically, some of those changes, they didn't completely go away. They are present until 6 days. So this is adult life of the mice. So it's a long-term consequence of something that happened during the gestational day 14 of those animals. So we asked the question if this would have any neurocognitive or psychological consequence for those animals. And the first thing that we did was to measure the motor ability or capacity of those animals. And we did that both at very early stage of life, P2 and P8, and then later on at young adults, P30 and adults P60 on those animals. And basically what we saw, and this was not a surprise because the animals were were severely compromised when they were born. You can just look at the animals, see they are different. But what we saw was that the animals that came from mothers that had sepsis, they had a impairment in the motor ability, so in muscle strength, motor coordination, and neuromuscular function, and that we did using tests that were designed specifically to test for motor ability, for strength, and so on in this age, in this population of mice, the young mice. So we used the cleft aversion test, the negative geotaxis, and hind limb suspension test to show that those animals that came from mothers that had sepsis, they had impaired motor ability, as you can see in the graphics here. But when we tested again those animals at P30 and P60, and then we use a different set of tests that is adequate to answer this in adult mice, was the rotarod. We saw that this is not difference between the control animals and the animals that came from mothers that had sepsis during the gestational period. So at the adult life, they don't have any motor impairment. So we moved on and asked if they would have any alterations in the behavior, and we looked for anxiety behavior in the first moment. We used different tests for that, the elevated plus maze and the light and dark box. Both tests, they basically rely on the exploratory characteristic of the mice exploring dark spaces or feeling more safe at dark space than at light spaces, and so we can do that and measure how long the animals stay exploring dark and light spaces, and this is a way, an indication that we can detect anxiety behavior. But basically what we saw is that there is no difference in these tests regarding animals that came from mothers with sepsis from control animals. They all behave the same on those tests, so there's no sign of anxiety being detected on those animals. Then we tested if those animals have impaired learning or memory abilities, and we did that by using the Morris water maze test. And in this situation, we did two tests actually. One to measure the ability of learning, and basically we put the animals in a small pool with a hidden platform, and the animals have to find the platform that is a little bit underwater, so we cannot see it, but it can swim around until the animal find the platform and he climbs on the platform. So we do that for 4 days in a row, and every time the animals goes in the swimming pool again, he knows the location of the platform, and he goes straight to the platform, and every time he finds the platform faster than the day before, so he learns about this. And as you can see here, this was not completely true for the animals that came from mothers with sepsis. They took they didn't perform so well, so they don't learn as fast as the animals that are from the control group. At the end of this period, we would take the platform out of the swimming pool and put the animals again there. And what we would measure would be the time that the animal spent on the quadrant where the platform was before. So it's a way to test for spatial memory of the animal. He remembers that quadrant, and he keeps swimming around that area trying to find the platform. So when we did that, we saw that the animals coming from sepsis, they also have a decreased spatial memory. So they didn't spend as much time as the animals, the control animals in the quadrant of the platform, indicating a decreasing spatial memory. We also did another, again, a fear conditioning memory test to show or to test for aversive memory in those animals. And then basically we put the animals in a cage that has a electrical wire in the bottom. So we put the animals there, and we ring a tone, and after the tone, we give a little shock on the animal. We take the animals out of the cage, and the next day we put the animal again in the same cage. We ring again the tone, but we don't give the shock. But when the animal hear the tone, it freezes, has a special behavior, it stops moving and freeze, waiting for the shock. So it's a behavior if he remembers the shock, of course. And when we did that, we saw that, oh, sorry, go back a little bit. We saw that those, oh, sorry. Here, yeah. So we saw that the animals that came from mothers that had sepsis, they don't remember so well. So they have a impairment in this kind of memory. Okay, so and we also tested for a depressive behavior in those animals. And we used two tests, the forced swim and the tail suspension, that basically measure the same kind of behavior, which is the immobility that the animal develops when exposed to a stressful situation. So basically, we put the animals to swim in a beaker, and after some time, the animals just give up swimming and float. Give up to try to escape the beaker and floats in the surface, and this is an indication of depression. So we did that. The tail suspension is the same thing, and we saw that those animals have a behavior. The animals that came from septic models have a behavior that is indicative of a depressive situation, a depressive behavior in these animals. So they don't have anxiety, but they apparently they have a depressive behavior, even in P30 or P60. So it's a long-term effect, as we've been talking here. So we, of course, want to make the correlation. We want to have translational results that could be explored also in the clinical scenario. That's the whole point of this. And so we look for actually correlations between our mice model and a clinical situation. And we started a clinical study with sepsis in a very young age in children, actually. And of course, I think you all can imagine how difficult it is to do something like that in specific this population, but we tried our best to have some insights from the clinical situation in this, and we actually started a cohort of patients. We have right now 33 patients included, and those are patients that we decided that we would include children from the neonatal period until the teen years, 18 years to be specific, with sepsis, and look for possible cognitive impairments in this population. Of course, we didn't get that far yet. This started a few years ago. We still have to follow up on this, but I'll show you some of the things that we already have. So this is our population that we have right now. We had 33 patients. The majority is between 1 year and 3 years of age, and the second most large part of our patients are less than 1 year of age. So more females than males in this population. The majority of sepsis came from respiratory tract, so pneumonia. We had only one death in this population, so 32 patients survived and was discharged from the hospital. And what we had as a inclusion criteria was sepsis with clinical signs or electroencephalographic signs of brain involvement, so of sepsis-associated encephalopathy, as I told you. So we want to look at those patients and see if they have signs of damage to the brain and also cognitive impairments later on. We didn't get to the cognitive part yet. We'll have to follow up on that. But what we did initially was to try to use some markers for neuronal lesion or neuronal aggression on those patients, and correlate that with the clinical signs of sepsis-associated encephalopathy or the electroencephalographic signs of sepsis-associated encephalopathy. And the first thing that we used was a NSE, which is basically a biomarker for neuronal lesion, and we didn't see any correlations that we could detect in this situation, nor with the clinical criteria, nor with the electroencephalographic criteria for sepsis. So we tried a different marker, and we also use S100B as a biomarker for, again, neuronal lesion. And again, we basically got the same results that we saw with NSE. So we couldn't really detect any correlation between the clinical signs of sepsis-associated encephalopathy or electroencephalographic signs of sepsis-associated encephalopathy with this biomarker so far. So it's a little bit frustrating. We didn't have a good biomarker that we could use so far, but anyhow, we have the clinical psi and the electroencephalographics for psi there. So we plan on following up those patients to see how the cognitive response will be later on. We tried, of course, to do some imaging studies on those animals, but this proved to be nearly impossible. It was very difficult to take those children to the MRI to have the exam there. So anyway, we will still follow up on this study and see if we can get something out of this. Well, basically, let me see. What I want to show you today was basically this, that we described a model of gestational sepsis that could be used to study the impact of sepsis during the gestational period in the offspring. And we could therefore ask questions about the long-term consequences of sepsis in the offspring. That's what we did. We showed that these gestational sepsis induce an inflammatory response in the neonatal mice, and that negatively impacts on the central nervous system development, and that is still detected at later stages of life. Also, we showed that cognitive and behavioral dysfunctions in the adult offspring can be linked to synaptic damage that remains from this initial aggression during the gestational period. And we suggest that maternal sepsis is another possible and maybe neglected risk factor for depression and learning and memory impairments in the adult life. So basically, is the take-home message that I want you to show. Let me just acknowledge people here. Marcelo Granja is a postdoc in the lab, and he, together with other students, Leticia, Flavia, and so on, and some of the researchers in the lab, they did most of the animal work with the gestational sepsis model. And Bruno Espírito and Arnaldo Prata Barbosa were our collaborators at the Institute of this Research, DOR, that did actually all the clinical part of the work. We have collaborations with the Instituto Pasteur, Instituto de Biofísica, University of Utah, and INI at Fiocruz. Our collaborators also were a very important part of the whole thing. So basically, that's the main idea here. Thank you for your attention, and I'll be happy to answer questions if you have. Yeah.
All right. Thank you very much. It was a very nice talk. We usually open the floor for the students, for them to make the initial questions. I wonder if there is any questions here. No. Let's see. Chat. Luisa, is there anyone on your side that would like to start with the questions?
No, for now, there's not no questions in YouTube as well.
All right. So, well, actually, Andresa de Ben would like to ask a question. So please go ahead, Andresa, and ask a question.
Can you hear me? Yes?
Yes, yes.
Yes.
Hello. Thank you very much. Hi, Hugo. Thank you very much for this so nice presentation. I like it very much, as always. And I was wondering, in that model of pregnant gestational sepsis, that it's very impressive that the pups in the adulthood present the cognitive impairment. But I was wondering if they are exposed to a second hit in adulthood, probably it could be exacerbate lots of signs of infection. So I would like to hear about this point. What do you think?
Yeah, that's an excellent point, Andresa. Thank you for your question. It's really something that we are doing right now, actually. So our idea, our hypothesis is that those animals, they somehow carry on a immunological scar that remains with them for life, basically, and probably they'll have a different way to respond to a second hit in this situation. Maybe it's something probably like the trained immunity that people talk about. Maybe it's something like that. We don't know if the mechanism will be the same, but we think that that's pretty possible. Actually, we had very preliminary results that show that early in life they have a completely exacerbated response to a second hit. If that would further impact on the neurocognitive development, we don't know yet, but we are doing the experiment. It's just that it takes a little bit to do that, because, as you know, we have to wait for the pregnant mice and steps and wait for the pups to come and then follow up. So it's a long experiment. So I hope that we'll soon have a more detailed results to show people. But that's a very, very important question, I think so, because that's real life actually. If you think about that, the children will be exposed to infections throughout their life. Maybe they have some sort of funny immunological response to aggression that would, I don't know, make it worse or not. I don't know. We'll see. Thank you.
Thank you, Hugo.
All right, great. I have a question, and your model is based on the sepsis insults being made during the pregnancy. And it's also the time that you show in one of your slides that the colonization of immune cells in the central nervous system is happening. And the microglia is usually from the yolk sac that these tissue resident macrophages are usually long-term populations with low turnover. And I was wondering if these colonization changes and you actually have different type of macrophages that are now colonizing these tissue. And you also showed a lot of data regarding the activation of these cells, but there is, or actually I may have missed, if there are any changes in the number of microglial cells that you have in these in the brains of these animals.
Well, excellent question, Bruno. Yes. Well, we are in the process of trying to characterize those microglia. We know that they are activated early after birth, and they remain activated at least at P8. We want to look at the phenotype of those microglia. We don't know yet if there is an alteration in the number of microglia there. Okay, I don't know if we'd be actually how we would do that, but anyway, that's a question that we have to think about that. I must say that this was not in our initial plan to quantify the number of microglia there, but more to look into the activation profile, if they tends to a more M1 or more M2, or if they change this during the development process, and this is still ongoing results. So I cannot tell you any results right now, just because we actually don't have any consistent results regarding this, rather than saying that they are activated early after birth. They have the morphology of activation early after this. One of the clues that we have is that TNF alpha is increased basically until P60. So it seems that there is some sort of funky immunological response going on there. So we have to explore that, but as I told Andresa, those are very slow experiments. We have to wait a long time to get animals, to breed animals, to have the pups, and to follow up the pups. So it goes very slow. The results on that thing is still ongoing. So I cannot answer, but that's my feeling. I think they're activated, and probably they'll have a difference in that.
All right, thank you. We got the ball rolling regarding questions. We have one here on the chat from Professor Rosalia Mendes Otero. That is, even with the antibiotics treatment, the animals show deficits in the adulthood. Is this a chronic inflammation? Should anti-inflammatory therapies improve this?
Excellent. Yes. So the main reason for us to use the antibiotics was because we didn't want all the mice to die or to have a stillbirth or to have a abortion after infection. So we needed to treat the infection there, and so we wait until the mice were sick. They were obviously with sepsis, but we want them to survive sepsis. That's why we use antibiotics, and apparently it didn't affect the initial damage that was caused in probably the first 24 48 hours of the situation there. If we can use anti-inflammatory drugs to prevent that, that's one good question. I mean, we know, and we did that in the past, that we can block or at least prevent the cognitive damage in the adult population with sepsis if we pre-treated the animals with antioxidant drugs, or let's say drugs with anti-inflammatory effects that are not traditional anti-inflammatories, such as statins are also effective on that. So we didn't have much success using conventional non-steroidal anti-inflammatory drugs. So I don't think that would be a good strategy to try, but anyway, it's a valid question, and we are not yet in the point where we will try different approach to interfere and prevent maybe the cognitive damage in the offspring. Of course, this is where we want to go. We are just trying to learn more about the process right now and see if we can pick drugs that would have a greater chance of success. Of course, looking into the translation to the clinical scenario, of course. So that's basically, I hope I answered your questions, but that's basically this.
Thank you, good. First, I would like to say that it was amazing. I love the data. I didn't read the paper, so it was fresh from you. It was great. Thank you. I was wondering, I have two small questions. One is based on what we were discussing with Bruno concerning changes in brain and your detection of elevated TNF-alpha there, and that you don't have exactly characterized the cells that are producing that. But I noticed that you have the brain barrier alteration for 8 days, I think. And it's when you measure TNF-alpha, and you also detect increase in lung and liver of the cytokine at least. I was wondering, have you measured in plasma, and do you think that this was really producing brain, or you have, extravasation of the cytokine? And what do you think about that? Or do you think, do you have alterations like mast cells in this because of the barrier alteration? What do you think?
Oh, great. Thank you, Chris. Always a pleasure. So yeah, that's a great question. And of course, one of our concerns is this TNF that's actually coming from activated microglia or other neuronal cells there, or is just TNF that was in the plasma and extravasated into the brain tissue because we had disruption of the blood-brain barrier. So the thing is, It could be both. It could be one or the other. At P2, at P8, I don't think it's that much the same thing, because if you look, okay, we still have a little bit more extravasation, but it's not as significant as it was in P2, and we still have TNF there. But at P30 and P60, we didn't have any brain barrier disruption, and we still had TNF. As you know, yeah, TNF is very labile. I mean, is a short-lived cytokine in the tissue and stuff. So it won't survive too long there. So we believe that we have some local production. The cells, I can only speculate. I mean, it's possible that microglia, mast cells and stuff. So we are looking into that stuff. So those is the first let's say paper that we published on that, and we wanted to make sure that the model was out and that people could think about it and use this model for other investigation. And we are following up on the things now.
Thank you. Let me ask you a different question concerning the second part of your presentation with the preclinical data that you have with the pediatric sepsis. I know that you were saying, oh, it was very frustrating, I didn't get a marker, a biomarker and everything. I was wondering if, because in the model, you have a very nice protocol with the antibiotics.
Sure.
And that is crucial for you.
Sure.
What about in the kids? How were the antibiotic? Can you separate groups concerning antibiotic procedures with the
Sure. Yeah. And that's of course wonderful. I mean, we that like animal models and laboratory, we have all this great, wow, let's separate for antibiotics because it's what we would do. But it's very different when we have a population of patients that the priority, of course, is the treatment of the patient.
Yes.
So the physician would choose the better antibiotic for the bug that the kid have in that moment, and will start antibiotic and stop antibiotic as the clinical situation requires. So basically, we didn't have much to say about any of that. And
but can you group?
Yeah, well, if we had like a significant number of patients, we could probably, make subgroups analysis of that. But we only have 33 so far. So it took a long time to get 33.
I can imagine.
It is really hard to do it. Not all the parents want to waive the consent to the protocol and stuff. So it is tough. But we will continue and see if we can get more patients. And maybe look at different markers. We still have some blood left, so we can do a little more analysis down the line and follow up maybe with cognitive tests and so on. Basically this.
Thank you, Hugo.
Okay.
Boy, Hugo, I hope you're not too tired.
Of course not. I'm having fun.
So it was great for me also to learn about your work. This is the first time that I saw this component of your professional life, and it's a big work. I was very curious, of course, about discussions on the mechanistic basis of the pathogenic process that you have described, and there are so many questions in my mind. First, whether you think that LPS is the major trigger of the processes that you see in the pulps, right? In the neonatal and young mice. I was very curious about the rarefaction of blood capillaries that you saw, because this is probably already a secondary phenomenon. I also thought about issues such as, how the repair process, the kinetics of regeneration of the tissue, And I wonder if all the work that Daniel Musida has shown us so many times, you know, showing how integrated is the responses coming from the microbiota to the central nervous system via participation of so many innate lymphoid cells, T cells, et cetera, et cetera. Now, in your model, of course, you have to use antibiotics at some stage because you want to preserve the life of the mice, right?
Right.
At this point, you know, I just wonder if the antibiotics, by changing the microbiota, could actually have some sort of impact in the regeneration process that you are seeing in this. So I think it's an interesting question and raises this possibility that you would have a more, of course, it's artificial, but from the scientific point of view, if you are interested in the mechanism, having a model in which you can only use LPS from Klebsiella and just open the barrier via some tricks, and there are some tricks that can lead you, you know, favor the entry of LPS, maybe you could get around that possibility and then look at the effect of the microbiota on the tissue regeneration, because if it depends on regulatory T cells, et cetera, et cetera, et cetera, so that could really open venues for a lot of basic research, thanks to your model. I mean, so it's really fascinating. So it's too many issues that I brought, but I think that this is the good side of your work. I mean, you are making us think about the process, right?
Well, thank you, Julius. I mean, so many important points that you made there. I'll try to address all of them. The first thing is about the LPS things that you did, and we actually have a LPS group in the beginning to show, and we show that it basically leads to the same kind of inflammatory alteration in the brain that we have with pneumonia, and this was basically a control for us that we did that, because when we look at the literature, what you see is most of the papers or the reports that dealt with this question, they used or LPS or different components of bacteria or different components of virus, or also to address the question if an infection during pregnancy would impact on the offspring. Our criticism to that is, okay, there is no infection going on there. It's just a model of, you know, you use some pump or some bacteria or virus derivative to induce inflammatory reaction, and then you see that the consequence of that. But it could be different, worse, or I don't know, but different with the actual infection. That's why we choose to use the actual infection, and of course it brings you closer to the clinical situation as well. So so it's in the literature. So if we use LPS or other sort of inflammatory stimuli, you can see the same kind of consequence, the inflammatory consequence, and alteration in behavior and stuff in the offspring. That's there to some extent. It's not there are not a lot of papers on that, but there are a couple, and basically has the same kind of response that we saw. So of course the microbiota connection, the gut brain connection is very important. It's something that a lot of people is working on right now. I think we have to look at that at some point, and that's why actually we did an experiment where we compared animals that received only saline and for a control, sepsis control, didn't have any antibiotic, with animals that also received saline as a septic insult, but did receive meropenem as an antibiotic, and compared those two regarding cognitive outcomes and changes in synapses, and they are basically the same. If you look at the slides that I showed you, my control is saline as a sepsis stimulant with meropenem as a treatment. So even the animals that didn't have sepsis had meropenem as a treatment, and I was actually concerned that a change in microbiota caused by antibiotic would affect somehow the behavior of the venom. So I want to be sure that what we are seeing is not an effect of the antibiotic, but an effect of the infection, the presence of the infection. So that's the control that I used to make the statistic and to do the experiment. So I think that kind of answered the at least partially your concern. But I do think that there could be change later in life, actually, in these animals that would somehow impact on this
the resolution,
brain.
right?
Yeah, in the resolution.
Stage.
Yeah, and we can clearly see that it's not a completely resolution there, and maybe that's related to the time point where the damage occurred. So one of the things that we want to do, and we start doing right now, is to move the septic challenge forward or backward a little bit, and see how it would impact on the synaptic alterations in the adult life, or the inflammatory profile in the adult life, or the cognitive damage. So if we do it a little late on the gestational period or earlier, how different would that be? And my guess it would be different because it's a different stage of development. So that's basically it.
We have another question from Claudia Benjamin.
Sure. Hey, Claudia.
Hi, Hugo.
Hi, how are you?
Hi. My question, nice data. I like very much. Congratulations. And my question is in the same line of Cristiane and Bruno, because it's amazing how you still get changes in the, how can I say, offsprings with the babies. And I was thinking, wondering if the reason, I don't know if I lose something or I lost your presentation, some part of the presentation, but if you know what the reason for this, like maybe is cell reprogramming at the same time that the mother is in the presence of a lot of cytokines, the baby also, as you show in the placenta, a lot of cytokines. So maybe it changes also the cells of the baby and the mother. So both has cell reprogramming. Do you think about it like microglia?
Yeah, exactly. That's what I'm bet at right now. My bet is that we have a reprogramming of microglia or astrocytes or whatever, because the exposure to the inflammatory reaction that happened during the gestational period. As we talked about trained immunity, like it's a non-genomic change in the immune cells, but it stays for long periods, even after generations and generations of cells, and so maybe that's what is going on there. Or as Bruno suggested, maybe because of the time line, the time point that we induce the sepsis, could be a point where microglia is migrating, or other cells are migrating to the central nervous system. This could be altered somehow when we have a different set of population established there, and a different response. And that's what we are trying to characterize there. And that goes back to the question that was asked before about therapeutic strategies. I think Rosalia asked that in the
with stem cells.
Yeah, with stem cells. So we're kind of trying to figure out exactly what's going on there in the kind of the mechanism, molecular cellular mechanism involved in that, and then we could probably pick up some suitable targets to deal with. So we're going to test the stem cell therapy on this mice. Tatiana Maron Gutierrez with us. Yeah, she is in the lab right now, and she's working with stem cells. So we are going to do that on those animals and see if we can prevent it and look at what's different if it works with the animals. So yeah, that's basically that. Yeah. Thank you.
Thank you.
All right, so we're going to take one last question from Miriam Werneck.
Hi, Miriam.
Hi, Hugo. I'm sorry. I had an appointment at my daughter's school, so I got disconnected a couple of times.
That's
so
cool.
Sorry. If I ask a question that has already been answered, I'll go back in the video and I'll listen to it. So I'm sorry for that. But I have a couple of questions because of the same, I guess, the same observation that Bruno, Chris, and Claudia made, the amount of cytokines in the placenta. So I was wondering if you had tried to do the experiment with interbreeding, crossing different lines, let's say bulb and black, and see if you get more of a rejection of the fetus, because you have such an inflammation. I wonder if the fetus is not syngenated with the mother, if you have a different outcome, maybe stronger, because then you have also a response against the fetus that would be closer to what would happen in humans. And so if you thought about that.
No, excellent. Yeah, I never thought about that, and you are completely right. Yeah, it's a possibility. I mean, we definitely need to look and test and see if it is this way. I mean, it's a great point. I've never thought about that. I was just too focused on, what's going on in microglia and what's going on. So, but this is an excellent point. Yeah, thank you very much.
Yeah, when maybe tolerance gets scrambled in that session. And then another case is thinking about all the data on sepsis in adults. If you do foster feeding of the fetus, like if of the newborn, or if the newborn are breastfed by the mom that had gone through sepsis, and that might have a different content in the breast milk, and that might, let's say, prolong the effects that they had intrauterus.
Yeah, that's actually something we thought about. And our postdoc, Marcelo Granja, he's a veterinary, and he was the one that suggested that we did that. We had some problems when we tried to do this experiment because some of the moms would not feed the animals. They would kind of reject the animals. So it was an unsuccessful experiment because some of the animals just died of inanition. They weren't fed. So we didn't have any results, but we actually thought of that as a possibility, and we tried. Maybe we have to do some kind of experimental I don't know, adaptation with the mother and the pups, and see if they would accept the pup. I don't know. So Marcelo is a veterinarian, and he was in charge of figuring this out. The first time we tried, it didn't work, but it's a good point, of course. Yeah, it's important.
I guess one time we were doing like the changes or trying to make transgenics. I think people use bulb C moms because they were better taking than black 6 moms.
Yeah.
They tried to a more caring strain because the black 6 tend to be a bit rougher. But I'm not sure that would be an option.
Okay, yeah, I'll tell Marcelo to try and do this. Maybe that could work, and we'll see. All right. Thank you.
Thank you very much. It was amazing. I really liked your talk.
Oh, thank you very much, Miriam. Good to see you.
Well, Hugo, thank you very much for brilliant talk, very exciting data. It got everybody excited thinking about all the different implications. And I'm sure that in the very near future, we are going to hear a lot more about this project. So thank you. Thank you very much.
Thank you for inviting me. Thank you very much.
No, it's really a pleasure, and it's too bad that we could not have you here in person, but soon. Let's go. All right. Thank you very much for all the audience today, and this actually is the last talk that we have for the first semester of 2022, and we'll pick up again soon in August. I believe that we'll restart this Immunowebinar series. So it was really a very nice closure for this first semester. So thank you.